Hello, and good evening, everyone. This is Congressman Jim Langevin. I want to thank you all for joining the call tonight. Uh, we're dialing it out right now as we speak, and more people will be joining the call. But we're going to get underway, and everyone will be joining in as they're contacted. But let me just begin by saying that I understand how concerning the current coronavirus crisis is, and that many people have a lot of questions, and that's why we're holding this live telephone town hall event tonight, and we're going to try to answer as many questions as possible. Tonight, you're going to hear from Rhode Island Department of Health Medical Director Dr. James McDonald, also Rhode Island Department of Labor Director Scott Jensen, and as well as Small Business Administration Director, District Director Mark Hayward. So I want to thank each of these gentlemen for being on the call. Let me just say that they have been working extremely hard to make sure that Rhode Islanders are safe and have the support that they need in this very difficult time. This is obviously a very real issue, and Americans' lives and livelihoods are at stake. We all take this very seriously, and that's why Congress acted swiftly to pass legislation to help on a number of fronts. First of all, we passed the CARES Act just very recently now to help families, workers, and small businesses that have been hit the hardest. I actually drove to Washington, D.C. For the first time. I'm actually my 20 years of being in Congress. I've always flown, but because of health concerns, it's being on an airplane is not wise right now. So I drove to D.C. for the vote to make sure that Rhode Islanders were represented. The package that we enacted provides more than $2 trillion in relief, including financial assistance to individuals with the one-time payments of $1,200 per adult and $500 per child. Those checks will be going out very soon. We believe the administration is telling us within about 2 weeks, around the 13th or 14th of April, is when those checks will be going out to the first 60 million people, and those will be direct deposited into people's accounts. But the CARES Act also supports local public health operations with $100 million for hospitals and other healthcare organizations, and $150 billion in state aid, and that's for Rhode Island's portion. That will be $1.25 billion for Rhode Island, and it also helps small businesses and nonprofits by backing $350 billion in forgivable loans to help make payroll and rent and pay utilities. This is important. So for workers who have lost their jobs, it also includes a $600 a week boost in addition to the regular unemployment to unemployment insurance benefits for 4 months, and a temporary unemployment insurance program for non-traditional workers such as those who are self-employed. This builds on the Families First Coronavirus Response Act, which aimed to protect families' health and financial well-being with things like free testing and paid sick leave for those who need it, and extended family and medical leave benefits. I also wanted to mention that in early March, we passed an initial emergency $8.3 billion funding package to help preparedness and response. This package prioritized funding for research and development of vaccines and therapeutics, support for the operations of state and local health agencies, and an additional $7 billion for low-interest loans for small businesses. So these are the high points of the bills that we passed. Again, this is Congressman Jim Langevin. For those who are just joining us now, we are focused on doing everything we can to ensure state and local officials have the resources and authorities they need to keep you safe. You can rest assured that I'm going to continue to fight for you. And now with that, I'd like to introduce the local leaders who have been working across all levels to help ensure the well-being of Rhode Islanders. Again, we're joined by 3 individuals: Rhode Island Department of Health Medical Director Dr. James McDonald, next also Rhode Island Department of Labor Director Director Scott Jensen, and finally also Small Business Administration District Director Mark Hayward. So right now, I hope you'll please join me in welcoming Rhode Island Department of Health Medical Director, Dr. James McDonald, who's been working on the front lines to keep our communities safe and healthy. Dr. McDonald, I want to just turn over to you to make some brief remarks before we get to questions.
So Congressman, thank you so much for inviting me. I live in North Kingstown, and I care very deeply about my town and my state, and it's great to be part of this. We did have 160 new cases we talked about today, and we're up to 1,082 cases. And just one concept I want to get out as a context setter is, a little over 13 weeks ago, no one knew what COVID-19 was. It was not a named or even a known disease. So we've really only been at this as a planet for one season of life. And it was only 37 days ago that Rhode Island had its first case. So this is all still very new. Having said that, a lot has happened. Some of it quite good. Some of it, well, we have all these cases. And regrettably, we've lost 27 Rhode Islanders with COVID-19. And many of those have been folks who are in the most vulnerable stage of life, folks who live in nursing homes. And those congregate settings have still been a challenge for us, and we're still working on strategies to minimize the spread to the nursing homes and do things to address that. We have seen a fair amount of expansion in testing going on today. Yesterday, we did over 1,300 tests, which is the most we've ever done today, and today will be even more than that. And testing is important just to illustrate the public health concept of case finding. In other words, we actually want to find every case we can so that person knows to isolate for at least a week. And we want to make sure that people who are around that quarantine, and we use the word isolation and quarantine, and those aren't common terms in our everyday parlance. You isolate ill folks. People who are ill are people who you isolate. The quarantine individuals are people who are exposed. They're not ill. They feel fine. And to some degree, one of the things to keep in your back of your mind is people who isolate and quarantine are actually doing a public service because they're giving up their own individual liberty to protect all of us by adhering to a quarantine order from the governor. That's something that's very important for them to do. And so we don't have a successful treatment yet for COVID-19. It's something you see a lot of chatter about in the news. A lot of people are talking about a lot of different options, but there really isn't an approved treatment just yet. There's things that are being worked on and things that people have good feelings about, but we still don't have an FDA-approved treatment yet. One of the biggest announcements that came out today was CVS is doing some testing, starting at Twin River today. They're planning on doing 1,000 tests a day with a new Abbott Pharmaceuticals point-of-care test. So we'll see how that pans out. So that's just enough for me to open, and I look forward to being part of the conversation tonight. Thank you, Congressman.
Very good. Thank you, Dr. McDonald, for those comments and the work you're doing. Now I'd like to introduce Department of Labor and Training Director, Director Scott Jensen, who is working hard to connect Rhode Islanders with unemployment services. Director Jensen, you're on the line.
Hi, everyone. Thanks for having me, Congressman. And by the way, it is a busy time here at the Department of Labor and Training, and the work that you're doing in Congress and the rest of our delegation is doing is really helping people because this is a tough time. And we hear it every day. And we're doing everything we can possibly do to get the benefits that you guys have been able to secure for people of the state actually in their hands. Let me give you a little bit of context about what's going on at the Labor Department right now. We hit a grim milestone here in the state of Rhode Island. Over the weekend, the 100,000th Rhode Islander applied for unemployment insurance. Just so you know, there are only 500,000 people in the workforce in Rhode Island, and we haven't even opened up the program that the Congressman was describing for independent contractors and self-employed people. So there is no precedent for the amount of people who are unemployed at once. That is meant to, really make us extra tolerant of our neighbors who are, in some rough times right now, and we all have to really stick together with each other. And also a plea. It's a plea that if you have to apply for unemployment insurance, you can rest assured that it's there, that our system is chugging along, but that we are swamped. So I can promise you personally that we're going to pay each and every person who is going to get benefits. But it is really helpful not to call back after you get a confirmation that we've got your claim, because all of the people who are answering questions are also the ones who are processing claims. So we're ramping up. You hear the governor talking about getting more capacity to do this work. We are doing that 24/7, deploying a lot of new technologies with the help of some great partners in order to get people benefits out the door quicker. The good news is I think we're going to be the very first state in the country to launch the pandemic unemployment assistance program that the congressman was describing. That means if you're a independent contractor, gig worker, or maybe didn't qualify for other kinds of unemployment insurance benefits, that tomorrow morning you can apply on the Department of Labor and Training's website. Also, part of that same relief bill is everyone who has unemployment insurance, regular unemployment insurance, and everybody who will get this new PUC claim, there will be an extra $600 payment on top of your regular UI benefits each week. I think it's important for us all to understand that that stimulus is meant to help our country recover out of this economic turmoil. Again, that's completely unprecedented. So if you've lost your job, really apply for unemployment insurance. That's what it's there for, and we'll get it to you. And we are really impressed with how patient everybody has been, and I can promise you that we're going to get through this, and we are going to get you a benefit if you apply.
Okay. Thank you, Director Jensen, for those comments. If you're just joining us right now, this is Congressman Jim Langevin. I'm hosting a live telephone town hall meeting right now. We have a special guest on the line, the Rhode Island Department of Health Medical Director, Dr. James McDonald, who just a little while ago gave brief remarks. We just heard from Rhode Island Department of Labor Director Scott Jensen, and now we are going to go to Small Business Administration District Director Mark Hayward. Mark, you are now live.
Thank you very much, Congressman. I appreciate you having me on this call tonight. And we certainly understand the importance of small business here in Rhode Island. That Rhode Island is 98.7% of all our businesses here are small by SBA standards, and we're here to support them. While I heard Director Jensen talk about unemployment, we want to get people off of unemployment and back into their small businesses. And the Paycheck Protection Program is designed exactly to do that. It's where an individual small business can apply for a loan that will end up becoming a grant, provided that they give us the right information. And I'd just like to give a couple of examples, Congressman. And one is, if your payroll is $1.2 million, so if you divide $1.2 million by 12, that's $100,000, and then you would multiply that by 2 times 5, 2.5, and that would end up being $250,000. And the purpose for that is for you to bring those individuals off unemployment and back on your payroll, and for the next 2 months. And everybody says, I don't quite understand why we would do that. We would bring somebody off unemployment. But you have to remember, Rhode Island and most of the people who work in small business are like family. and what they're trying to do is take care of their family, and this is a very important program and an opportunity to do just that. The 0.5 or the 50,000 of that 250,000 is for specifically for that small business owner to pay the rent, to pay whatever debt and the interest on the debt they currently have, to keep the lights on, to keep the gas going, and to do whatever is necessary in order to pay the essentials of the business going forward. I want to read a couple of things because we keep referring back, or I do, to the interim final rule. And it says, what qualifies as payroll costs? Payroll costs consist of compensation to employees whose principal place of residence is in the United States in the form of salary, wages, commissions, or similar compensation, cash tips of the equivalent based upon the employee's records of the past tips, or in the absence of such records, a reasonable good faith employer estimate of such tips. Payments that include vacation, parental, family, medical, or sick leave, allowance for separation or dismissal, payments for the provisions of employee benefits consisting of group health care coverage, including insurance premiums and retirement, and also payment of state and local taxes on compensation of employees. For an independent contractor or sole proprietor, wage commissions, income, or net earnings from self-employment or similar compensation. So the maximum that was provided in the CARE Act was $100,000. So the reason why I always give this is so that people understand this is above the $100,000. If you have somebody who's making $100,000, you take these additional costs and you add them in, and you come to one particular number. And again, you do the same kind of math that I provided you before. This is an opportunity, again, to bring people back onto the payroll so that you can assist your people who basically your family in support of the small business. Congressman, there's a lot of questions about a lot of programs. I'm going to yield back to you, and I'm more than happy to answer any questions that anybody has.
Thank you, Mark. I appreciate that. That was Mark Hayward, our regional SBA administrator. Thank you for being on the call, and we are now going to go to questions. For those people who have questions, you can press *3 on your phone, and you'll be put into the queue, or *6 for our newsletter if you want to be kept up to date going forward. So *3 if you want to ask a question now, *6 if you'd like to be added to our newsletter. With that, again, for those of you that are just joining, this is Congressman Jim Langevin, and you're listening to our live telephone town hall meeting, and we have three special guests with us: Rhode Island Department of Health Medical Director Dr. James McDonald, if you have the health question, or we also have Rhode Island Department of Labor Director Scott Jensen, and finally we have Small Business Administration District Director Mark Hayward, each of who have made comments. So we are going to go to our first question right now, and the first question is from Dave Dedekian, and I believe, Dave, you're on the line, and we have a Department of Labor question for you.
Maybe Dave's on mute.
Okay, hold on for 1 second. So we're going to come back to
Dave.
Dave.
Should be fine. Dave should be fine.
Oh.
Go ahead, Dave.
Okay.
Oh, was I on mute there?
I'm not sure, but we can hear you now.
Go ahead.
All right. Thank you. Actually, I've got an SBA question for Mark, but Scott, I look forward to trying the self-employed unemployment insurance app tomorrow morning. I'm glad to hear that you're using Amazon Web Services to run that, and appreciate all the work that you guys are doing. And thank you to Dr. McDonald as well. But Mark, I wanted to ask, as we get going here, I've been in continual correspondence with my friend Rick Simone for the last 3 days, and I know you had a long conversation with him today about the EIDL applications.
Yes.
And, we discussed on Friday, and then Rick confirmed again today, that if you've applied through the COVID-19 SBA website application for the EIDL, which includes the $10,000 advance, up to $10,000 advance, that if you applied before March 30th, that you have to reapply. And I wanted to confirm that was the case. I'm sure it is, since I don't think Rick would pass me wrong information, but I wanted to confirm that was the case. And if that is, then how are you addressing sending out that information to all the thousands of people, not only in Rhode Island, but probably across the country, that have applied before March 30th? And what is the case, the status of going forward with this EIDL? Because that's an extremely important part of the loan process for a lot of small businesses here in Rhode Island. And while I was muted, I didn't get a chance to say thank you, Congressman. I appreciate this.
Thank you, Dave.
So on the EIDL, yes, Rick is absolutely correct. And the reason for that is our website platform changed because prior to that particular date, the agency did not have access to the EIDL Advantage program. That was part of the CARE program package that was passed by Congress. So when the new website went up that included that, it allowed individuals to go in and then designate that they actually wanted to have the advance of up to $10,000. And I must say it's up to. It's not an absolute. And it's my understanding there's a lot of moving parts on this, and Dave, and I apologize for it. If I was running it, maybe it'd be a little bit different. But yeah, I was told from our disaster team that they were actually out and notifying people that they had to reapply. And my understanding is if you do reapply in requesting the $10,000 or up to $10,000 advance that could be forgivable, that basically those two applications would end up getting merged.
Thank you, Director Hayward. This is Seth. I'm Congressman Langevin's Chief of Staff, and I'll be the moderator for tonight's telephone town hall. We do have over 8,000 people that are calling in tonight, so if you can do us a favor and please make your question as quick as you can. That way we get as many questions asked as possible. That would be great. For our next question, we're going to go to State Representative Kathy Fogarty. Representative Fogarty, you are now live.
Thank you, Congressman Langevin. I have a couple of questions for Director Scott Jensen. One is people keep calling me regarding that they put their claims in and that they were expecting some type of a confirmation or a callback that it was in process. So that seems to be a little confusing for some people. So I wanted to have that addressed. And then I was also wondering if the $600 would that also apply to part-time employees who are laid off because of the coronavirus, or just full-time employees? And if I could sneak one more question in for Dr. McDonald, when will the antibody test be available so we can start getting people to work, or when is his best guess that will happen? Thank you.
So I can go real quick. I'm sorry, it's been a long day. The $600 will be available for people with part-time work. So it is a very generous benefit. And again, I think it's important for people to understand that it's a stimulus for the economy, and that's what it was designed to do. When it comes to calls and emails that people are expecting, there are a number of reasons that doesn't happen. Sometimes people give us the wrong email address. So if we get the wrong email address, we can't get them that confirmation number. And then sometimes we are sending that in the mail, which takes a little bit of time. And then the third instance, and this is the one that is the most important one to me. There's a web confirmation page, but every time somebody hits to get confirmation to try to figure out where they are exactly in the process, that takes bandwidth. And our system's designed, to deal with recessions, not deal with pandemics. So when so many people are hitting on that, it will spin for a long time. Our system is very stable and hasn't crashed, but it will spin for a long time. So people will, the best advice is for folks when they get a confirmation email, the very first one, we've received your claim, give us 10 to 14 days and do everything you can do to resist the temptation to ask. I completely understand it. We are working around the clock. If we're not going to let people's benefits, we're not going to forget about them. We're not going to let them fall through the crack. We're going to process them as quick as humanly possible. So I know people are frustrated, and they need to work with us on that.
Thank you, Director Jensen. Again, you're on the telephone town hall with Congressman Langevin. A couple housekeeping things. If you want to ask a question, please hit *3 to ask a question. Also, if you'd like to be added to Congressman Langevin's distribution list, email, etc., please hit *6 and someone will take your information. Congressman, our next call is Sherry from South Kingstown. Sherry?
Good evening, Sherry.
Sherry, you are now live.
Good evening, Sherry. You might have to unmute your phone. You're on mute.
Hello? Yep, we're looking for Sherry from South Kingstown. We seem to have lost Sherry. Congressman, why don't we go to, we'll go to Michael from Warwick, Congressman.
Very good. Michael, are you there?
Michael from Warwick.
Hi. It's Michael Zarman, Warwick. Thank you, Congressman Langevin, and thank you to your staff members and your guests for participating in today's town hall conference. Question I have is for Dr. McDonald. Dr. McDonald, you mentioned additional testing capacity at Twin River Casino with the Abbott test kit. Questions I have on that are, is a physician's order required for that testing? And then also, what is the number to call to schedule a testing appointment there, given that some elderly people are not computer savvy and may not have computer access? Dr. McDonald, thank you.
Oh, hey, Michael. So thanks for your question. So you don't need a physician order to get the test through the CVS project. And CVS is lead on that project. And the way they've set up scheduling is through their website, cvs.com. So I know folks sometimes have challenges with the computers, but cvs.com is the best way to at least start with that and see where that goes. The test that CVS is doing is the Abbott test. And just because that may not be familiar to everybody, I want to just throw that out a little bit. That's a swab you put in someone's nose. So it's the same nasopharyngeal swab that we do with the state health department. But the test they're doing is actually different, and you get a result within 15 minutes. So it's a new test. It was just FDA approved, and the first day it could be available was today. So CVS got 30 machines on their own, got a lot of Abbott cartridges to do the test, and has been able to start deploying that test as of today. I do want to circle back to Representative Kathy Fogarty's question, though, because Representative Fogarty had a question about the antibody test, and that's a different test altogether. Now, the serology test, or the antibody test, is a blood test, and that just got FDA approved as well, but it's not widely available yet. But that will give people an idea of whether they have immunity or not. It should not really be holding people up getting back to work, though. And the reason why I want to make that really clear is the CDC has issued guidance, and the Rhode Island Department of Health has endorsed that if you have COVID-19, you need to isolate for 7 days, at least 7 days, and you need to have at least 72 hours without fever, without taking medicine to reduce your fever like Tylenol and Motrin. And a third proviso here is you need to have your other symptoms improving, like a cough or body aches. So if you meet all those three criteria, you don't have to isolate anymore. So you don't need a test to get back to work. Where a serology test will be helpful, though, or that antibody test that Representative Fogarty was asking about, was we can do some surveillance. In other words, there might be some folks who had a subclinical infection, as with other viral infections, and that may be worthwhile learning and knowing about that. One of the things that we don't know for sure yet, and we want to make sure we just keep this in the back of our mind, is we don't know that having COVID-19 means you have lifelong immunity. Keep in mind, the SARS-CoV-2 virus is from the family of viruses called coronaviruses. And they're one of the many viruses that give us a common cold. And we don't generally get lifelong immunity from a common cold. So that's something we still don't know right now. It's something that is being settled as a question throughout the globe. So thank you, Representative Fogarty, and thank you, Michael.
Thank you, Dr. McDonald. Again, you're listening to Congressman Langevin's telephone town hall. We're now about halfway through. The call will end at 8 o'clock. A couple housekeeping things. If you want to ask a question, please hit *3. If you would like to join Congressman Langevin's distribution list, please hit *6. I do want to give you a couple of phone numbers. I'm going to tell you the next time, so if you want to write down some of these numbers, grab a piece of paper and a pen, and I'll give you some phone numbers from some key numbers to call later. But next, Congressman, we're going to turn this over to Justin from Coventry. Congressman Langevin, you are next with Justin from Coventry. Justin, you're live.
Hi, Congressman. Thank you very much for taking my call and all the associates that are in this call. I appreciate it. I am a business owner in Coventry, and I have a question about the SBA loan. Once approved, how long would it take to probably get the funds is one question. And the other question is, I know that we're doing the $600 for the unemployment. Are you at all concerned that this may be abused?
Justin, thank you for your question, and we're going to go to Mark Hayward in just a second. We know that that people are hurting right now; they're unemployed, and we're trying to get money into people's hands as quickly as possible. We believe everybody wants to work; they'd rather be at work and holding a job, and that is, we approach this with good intentions, but we want to be responsible about it. So with that, I'll turn it over to Mark.
Just an FYI on the latter part on the $600, and I we've talked to a number of small business owners who have said that the benefits that they provide to their employees in many instances go beyond that $600. So there is definitely a trade-off there. So there's no question, because the individual would be coming on or coming back with all of the benefits that are being provided. So I just want to put that kind of out there so that people can think about it. As it relates to the loans, there are many lenders that are currently, even as I speak, who are in the system right now. And we've had system issues as well, because our systems were never designed for this kind of capacity. But they are in, they are approving, and they are getting loan numbers. We hope within the next 24 to 36 hours, we will have the sufficient documentation to give to our lenders, which is an authorization and a note, in order for them to close the loans. We anticipate that upon closing the loans, and a lot of this is really going to be done electronically, that it would be seamless before they put the funds in the individual's account. So I don't think it would take very long at all.
Thank you, Mark.
Thank you, Director Hayward. Again, you're listening to Congressman Langevin's telephone town hall. Housekeeping, hit *3 to ask a question, *6 to join Congressman Langevin's distribution list. As I said, here's a couple of key phone numbers for you. After tonight's call, if you do have a question that does not get answered, please just stay on the line, and you'll be able to leave a voicemail where you can ask your question, and Congressman Langevin's staff will get back to you. Also, if you have a question for the Rhode Island Department of Health, the COVID hotline is 401-222-8022. The workplace line at the Department of Labor and Training is 401-462-2020, and also the phone number for the Rhode Island Commerce Small Business Helpline is 401-521-HELP. And then finally, if you do want to reach Congressman Langevin's office at any time, that phone number is 401-732-9400. Congressman Langevin, next we're going to go to Donna from Johnston. Congressman, you now have Donna. You are now live.
Can you hear me?
Good evening, Donna. Yes, we can hear you. Thank you for joining us tonight.
Thank you for hosting this. But I have a couple of questions. My first is the $600 per week extra every week. Is that just, in the 13-week extension, is that just apply to people who have lost their job COVID-related, or if they were on unemployment a few weeks prior to that?
Very good. Thank you for your question, Donna. And it's a question I'm going to turn to Director Jensen.
Sure. Anybody who's on unemployment insurance will be eligible for that $600. And the DLP will add that automatically. So you don't have to reapply or anything like that.
Thank you. Thank you very much, Director Jensen. Oh, I'm sorry, Congressman. Go ahead.
No, I was just thanking Director Jensen for the answer to that question. I'm sure a lot of people are wondering the same thing.
We have over 8,000 people on the line tonight, so please, if you can ask your question quickly, we'll do our best to get as many questions asked. Congressman, your next question is Diane from Johnston. Diane, you are now live with Congressman Langevin.
Thank you, Congressman Langevin, for reaching out to residents to answer questions. On TV at the press conference, there's lots of questions I asked, but mainly they're from reporters and talk show hosts, so I really appreciate this opportunity to ask this question. The governor states at present the hospitals have enough of masks, gowns, etc. We have a family member in a nursing home. What steps are being taken, or is there someone overseeing these facilities to ensure the workers at nursing homes have necessary amounts of masks and gowns to take care of the residents? We recently received a letter asking for mask donations, so we're a little bit concerned that nursing home may not have what they need. Do you have any reassurance for families regarding this?
Diane, thank you for your question, and I'm very concerned about PPE. We know there's a shortage of PPE around the country right now. That's why we put additional funding right from the beginning with the $8.3 billion package to acquire additional personal protective equipment for our frontline healthcare workers. I know that the state is making a very strong effort to disperse that around, but we are still making sure that we are acquiring more. I'm going to turn that other half of the question, though, for additional comment to Dr. McDonald.
So thank you, Congressman. So, yes, right now we have pushed all the personal protective equipment to all the nursing homes. So right now, nursing homes do have personal protective equipment. And in particular, one of the things that we put into place just a few days ago was requiring healthcare workers in a nursing home or a hospital to wear a surgical mask, the same type of mask you'd see during a surgeon doing an operation. And they have enough of those as well. You know, one of the problems with this pandemic is the national personal protective equipment shortage. And, you know, just to kind of put it out there, it's like we don't have enough gowns, we don't have enough masks, we don't have enough N95 respirators. Those are things that we just don't have. But right now what's happening is because we had a stockpile in Rhode Island, we've been able to tap into that and deploy that. Now, we've done it somewhat strategically, and we've issued guidance from the Department of Health to all the healthcare workers to how to do this in a manner to conserve your personal protective equipment. In other words, how to make it last as long as possible. And we're looking at strategies to disinfect so we can reuse some of these products again, which is something that other countries have done. So, you know, as the national supply chains have not been able to meet the demand, which is because this is a pandemic, we're in this pickle together here. But right now we're doing okay. I want to assure you that I listen to the governor about this every day. She is literally scouring the earth, and I mean scouring the earth to find more PPE. We got in 500,000 surgical masks last week. We got 100,000 N95s in over the weekend. We're running 7 days a week, 24 hours a day, so we do get more supplies, and we're doing our best to get more. So we're very careful about this issue. We're looking at it very closely.
Thank you for that answer, Dr. McDonald. I also want to mention that in the second package, aid package that we put through last year before the coronavirus even hit, I had actually introduced legislation called the Healthcare Workforce Protection Act. And what that did was allow us to, in times of emergencies, allow masks that would traditionally be used by construction workers, but were basically of equal quality to the N95 masks. They just hadn't been through the FDA approval process. But in times of emergency, this would allow those construction quality masks to be used by healthcare workers. So we included that provision, that bill basically in the second stimulus package, which is going to add millions more masks to the masks that are available to our frontline healthcare workers. Those masks are actually made by, for example, by Honeywell. That's going to also result in addition, because that's the company that's a presence in Rhode Island. That's going to be another 500 jobs that are going to be created to help create those masks that now we're going to be used for construction, but now can be used by frontline healthcare workers. And again, they're of equal quality to the N95 masks. So I just wanted to add that. But that was in the in the second stimulus bill that we put through, as well as the third stimulus bill.
Thank you, Congressman Langevin. Again, you're listening to Congressman Langevin's live telephone town hall. We have about 20 minutes left, so just as a reminder, please make your questions as quick as you can so we get as many people in. And if you do not get your question answered, please stay on the line afterwards, and you'll be able to leave that message. Congressman, our next caller is going to be David from North Kingstown. David, you are now live.
Thank you for listening to my question here. Very technical one. 2 weeks ago, applied for unemployment benefits. Friday, I was sent a letter. I was denied. I'm a self-employed antique dealer doing a lot of shows and flea markets. Now, tomorrow morning, there'll be another contract going on. The computer, I believe, at 8 a.m. Should I fill that out and get another confirmation and just disregard the confirmation that was used 2 weeks ago when I applied through regular unemployment?
David, that's a very good question. That's going to be a question for Director Jensen to answer, but I will tell you this. We specifically, in the third stimulus bill, included people basically in the gig economy, the people that are self-employed, say non-traditional employees that would otherwise have been left out in previous unemployment provisions. We designed a provision to help people in that self-employed gig economy type situation that you just described. So let me turn that over to Director Jensen, because I believe that, as you stated, goes live tomorrow morning when people can apply. But I'll turn that over to Director Jensen.
Okay.
Great. And David, you're exactly right. You should apply tomorrow morning. That first confirmation email you got was for that claim that was denied. You probably got an email that encourages you to apply for the benefits and may have even asked you to sign up for a waiting list. Is that right?
Yes, sir.
Good. Our system's working. So, yes, apply tomorrow morning, and we will get those things through as, this is a technical term, lickety-split. Because I think the benefits for the self-employed, our Congress made those very streamlined. So thanks to Congressman Langevin and others, we're going to be able to do those a little bit quicker. But again, be patient with us, about 10 days, 2 weeks with those after your application's complete.
Thank you,
Thank
Director.
you for that question.
Thank you, Director Jensen. Again, you're listening to Congressman Langevin's telephone town hall. We have a little less than 20 minutes to go. Remember, if you do want to ask a question, please hit star 3. If your question is not answered, stay on the line afterwards, and you will be able to leave a message there, and someone will get back to you. Also, please feel free to hit star 6 to join Congressman Langevin distribution list for future information. Congressman, our next call is going to be Mark from Narragansett. Congressman, you are now live with Mark.
Good evening, Mark. Thanks for joining us. Okay, do we still have Mark there? Great.
Mark from Narragansett, we still have you? I apologize, Congressman. It looks like we lost Mark from Narragansett. We will go to our next caller. We're going to go to Ed from Providence, who seems to have a very quick question. Go ahead, Ed. You're with Congressman Langevin.
Hi, Congressman. Congressman, thank you for doing this evening. This is for the doctor. The surgical masks, not the N95. How many times can you disinfect them with Lysol or spray before they need to be discarded?
Thank you for that question. I'm going to turn that for Dr. McDonald.
Thank you.
So, Ed, I don't know that I would clean it with Lysol or disinfect it. What I would rather you do is actually store it in a paper bag when you're not using it. And the way I would look at it is I would only wear it when you're around other people. Because if you're home, you don't really need to wear it. It's for where you're going out. And, what we're asking healthcare workers to do is to wear it for 3 working shifts. Okay. And that may sound like a lot, but I can tell you it does work. You just store it in a paper bag in between. It works just fine. But I wouldn't spray it with Lysol. I just wouldn't do that. I don't think it's going to help the mask at all.
Thank you very much, Dr. McDonald, for that answer. Dr. McDonald, I had a quick question. I know on the news the other night, I saw the company that is disinfecting the N95 mask. They basically send the old mask to this this company, they disinfect them, and they actually send masks back. Is Rhode Island participating in that at all?
Yes, so I think you're talking about the company Battelle, and the director is planning on making an announcement about that this week. So obviously I'm hinting that, yes, we are going to be participating in that. We're one of the few states that will be taking advantage of that. And what the congressman's referencing is the N95 respirator mask that doctors use when we're in the operating room or in the hospital, but we're trying to make sure we're not getting the infection ourselves. That is a pretty sturdy three-dimensional object there, but it can be disinfected with a particular hydrogen peroxide type vapor. So there's a company that's found a way to do that where it can be disinfected up to 20 times. Something we really would prolong. So I would expect the director to make an announcement later on this week about that, Congressman. So thank you so much.
Excellent. Thank you, Doctor.
Again, you are listening to Congressman Langevin's telephone town hall. We have about 15 minutes to go. So in these final minutes, please make your questions as quick as you can. If you do have a question, please hit *3 to ask your question. If you do want to sign up for Congressman Langevin's distribution list, please hit *6 and someone will take your information. Congressman Albert has a question that I think is on a lot of people's mind. You are now live with Albert. Congressman Langevin.
Good evening, Albert. Thanks for joining us. Hi there.
Good evening, Congressman. Thank you for taking my call. Quick thing. A lot of guys like myself are self-employed contractors, and previous to Corona, the virus, a lot of stuff was going on. So, long story short, a lot of places canceled work, and myself, you work for a lot of people and they give you 1099s. So right now you're totally out there and with nothing. You're going to the computer's down, it's broke, it'll be fixed. Don't have the money to do it. So I really my phone really doesn't have any way for emails. So I don't know if there's any way that I can get some paperwork or something from the Rhode Island Labor of Training, or maybe they can help you out in some way, or paperwork, because I don't have any access to get to a library, or you don't have any access to anybody to use it in their home, because I understand that. So you're really kind of like a catch-22 congressman. You need some kind of help here if you are eligible to apply for some kind of benefit with this. That's why I feel like call and ask.
Well, I'm glad you called in. It's an important question. I'm going to turn that over to Director Jensen for comment.
Okay. Thanks for making that comment, and I hear you. A couple of things. The first thing, if there's any way safely, and only safely, with all the social distance protocols that you've heard about, you can get to a computer or even call somebody and have them type it in for you. That's the best way to do it, because online is better. If you can't, and there are going to be people that can't, we have a number that you can call during business hours, 462-2020. That is not the UI call center. You can, of course, call the UI call center. That number is on our website. It's 243-9100. That is a very busy number, and if you can't get through, you can try that 2020 number. Somebody will take your name, and they can have somebody call you back, and we can do it through paper. It will take longer. That's the bad news. The good news is you'll get all the benefits starting the minute you apply. So if it takes us a little bit longer to get you a check, that check will be in the rears. It'll be bigger. But if there's any way that you can do it online, that is by far the best way to do it. So again, thanks. I know a lot of folks are in that circumstance, and it's a good thing that you asked.
Very good. Thanks for the question, and thank you for that answer, Director Jensen.
Also, you're listening to Congressman Langevin's telephone town hall. Director Jensen gave the number for the Department of Labor and Training, which is 462-2020. Also, the hotline for the COVID with Department of Health is 222-8022. And also for the small business, Rhode Island Commerce Small Business Helpline, that phone number is 521-HELP. And then Congressman Langevin's office number is 732-9400. We have about 10 minutes to go. Remember, hit *3 if you want to ask a question. And if your question is not answered, because we have over 8,500 people that have been listening this evening, just stay on the line afterwards, and you'll be able to leave a message, and your question will be answered by someone from Congressman Langevin's staff. Congressman, next we're going to go to Melissa. Melissa, you are now currently live. Congressman Langevin.
Hi, thank you.
Good evening, Melissa.
Good evening. I have a question. I own a small business in Rhode Island. My CPA had advised me to apply for the Paycheck Protection Loan. However, he said I could only apply for one loan, not the EIDL loan. And now I'm hearing that I can apply for both. I was just wondering if I could get some clarification on that.
Very, very good question. I know that it's on the minds of a lot of people. I'm going to turn that over to Mark Hayward from SBA.
Thank you, Congressman. The answer to that is yes, you can apply for both. The Paycheck Protection Program is specifically for 8 weeks of payroll for your particular employees, and then 0.5 for your ongoing expenses that you have. What you cannot do is you cannot apply for, because remember, the Paycheck Protection Program is a loan that, provided that you, at the end of the 8 weeks, and we don't have the actual number of weeks, it might be 10, might be 12, you would bring your documentation back to the bank, and then the loan would be forgiven, and it would convert over to a grant. On the other side, you cannot use economic injury disaster loans for the exact same thing that you just used the payroll protection program for. So that would be used for more long-term economic injury beyond the 12 weeks, something about working capital or expenses that go much, much beyond that. So the answer is yes, you can do both.
Okay. All right. Thank you for the clarification.
You're welcome.
Very good. Thank you very much for your question, too.
Thank you, Director Hayward. Again, you're on Congressman Langevin's Town Hall. We've got about 10 minutes to go, so we've got time for a couple more questions. So if we can make them quick, we'll try to get in as many as we can. Congressman, next we are going to go to Joanne from Warwick. Joanne, you are live with Congressman Langevin. Congressman Langevin, Joanne from Warwick.
Hi, Congressman. Thank you very much. Thank you, everyone there, for coming together tonight. I just have a very
Thanks for being on the call.
Thank you. You're welcome. Today, the governor said that if you've been waiting more than 2 weeks for a payment, that you should call unemployment. So I was approved. It's been over 2 weeks, and I keep calling, but you can't get through. You can't get through online. You can't get through on the phone. So I was just wondering, what do you do in that case?
Well,
very good question. Mark, go ahead to Scott.
Have you certified? And did you make a phone call over the weekend and certify for a payment?
Director Jensen, I apologize. She's actually going to be muted and can't go back to you. I apologize.
Oh, okay. So the UI, the process is a little bit complicated. At least I think it is, especially if you've not done it. So the first thing that has to happen for us to pay a UI claim is processing that claim. And by that, we mean figuring out if you're eligible and how much you're eligible for. Once that's done, you're good. You get notified that your claim has been approved and how much it's approved for. And then every week, you have to certify that you're still out of work. That's part of the rules in Rhode Island and almost every other state as well. So you then have to call. And once you call, if you set up direct deposit, we'll wire money into your bank account within 48 hours. And some folks are getting checks still, and still others have an arrangement that the bank will put in money into an ATM card. So depending on what arrangement you have, that's sort of the process. So in order to really answer this question, you need to know if somebody's certified. So again, there are many sort of steps in the process. If you have questions, your best bet is 462-2020. That phone number before. We're trying to get people to allow the call center people, the actual UI claims processors, to get those claims out the door. So we have about 30 or 40 people each day who can answer some straightforward questions. like the one, hopefully, that the caller had.
Very good. Thanks for the question, and thank you for that answer, Director Jensen.
So we only have about 5 minutes left, so we'll try to get 2 more questions in if we can be quick here. Congressman, we're going to turn it over next to Janice from Warwick. Congressman, you have Janice live from Warwick.
Very good. Janice, welcome. Thank you for being on the call.
Thanks for having me. I have a really quick question. It's more of kind of like an opinion, actually. I'm a registered nurse. I'm retired. And worked much of my career in critical care, with infectious diseases and things like that. My question and my thoughts are, I appreciate Governor Raimondo's clear guidance with this, with social distancing, with the mask wearing, but the one thing, and the quarantining, the one thing I disagree with, and I'd like Dr. McDonald's opinion on this, is our open spaces. We need to reopen them because people are already, quarantining. They're going stir crazy. The one thing we have to look forward to is to get in your car and go to an open space and look at the ocean and even just stay in the car, not even if you're going to go walking or anything like that. I've done that with my 87-year-old mother before they were closed down, and we just had a wonderful day just to get out and breathe and look at beauty. So that's my concern, is that this is a little too confining. We're already confined. We already don't work. We're not going out. We're not having gatherings. And the one thing we do have is open space, and that is the one healing thing with great open air, where you really can't get the coronavirus unless you're not social distancing. So it's pretty much
comment.
the safest place on earth is to be in open air. Thank you.
Thank you for your comment. Dr. McDonald, I don't know if you want to comment on that one.
No, I really hear your point, and I think that we all would agree that there's nothing more relaxing than walking along the ocean and strolling through one of our parks. So as I understand the governor's decision, what it was based on was she consistently wasn't seeing social distancing occurring at these locations. In other words, there were too many people gathering too close together. And I think these are difficult decisions that leaders make sometimes, and we're really in a very difficult time, and we're trying to really make it a less difficult time. And I totally appreciate your point of view and your perspective and your experience, and thank you for your service and your career. I think what we're stuck with, though, is that we have one opportunity to really mitigate the terrible effects that we could have from this virus, and the surge is going to be bad enough. So some difficult decisions have had to be made that are in the best interest of all of us. But there's no doubt about it. We're all sacrificing, and I think one of the things you really see here is the sacrifice of all of us, where we have to, just not enjoy the pursuit of happiness, as it were, for so many of the things that we find so near and dear in Rhode Island, like our parks and our beaches. But my understanding from the governor was there was just too many people who weren't adhering to it and didn't respect the power of the virus. So we're all stuck with this difficult situation together, but I so appreciate what you're saying.
Very much for the question, and Dr. McDonald, thank you for the answer. These are obviously very challenging times, and we're trying to keep people healthy and also prevent the spread of the virus. And these are tough calls that we're all making right now to try to get us all through this. That is bringing us to the top of the hour right now. Someone did have a question on whether people on SSDI were able to get a stimulus check, and the answer is yes. We've covered all of the different provisions if you're on SSI or SSDI that you will get a stimulus check. There will be a delay. You should know that because the IRS and the Social Security Administration, they have to sync up their databases. Believe it or not, I learned this recently, and that will be a bit of a delay. That they're not operating on the same systems, which is unfortunate and surprising. But there's going to take a little bit of time to get checks out to people on SSI. You'll be a little bit later in the process, but the plan is that yes, people on SSI, for example, will get a stimulus check, that $1,200 check. With that, we are at the top of the hour right now, so I just want to thank you all for joining us tonight. Your thoughtful questions are important. We had a very high call volume, and I apologize that we weren't able to get to everyone's question. We've close to between 8,000 and 10,000 people on the call. So if you do stay on the line, you can leave a message, and we will do our best to get back to you as soon as possible. You can also sign up for my newsletter by dialing *6. And if you ever have a question or need assistance with a federal agency, you can please call my office at 401-732-9400, and we're here to help you. You can also go on my website at congressmanjimlangevin.com. We're going to be listing many of the important phone numbers that we talked about tonight, but I just want to close by thanking Rhode Island Department of Health Medical Director Dr. James McDonald. I want to thank Rhode Island Department of Labor Director Scott Jensen, and finally Small Business Administration District Director Mark Hayward. Thank you for your participation, your thoughtful answers tonight. I want to thank everyone for being on the call. I apologize that we weren't able to get to everyone, but the numbers that we talked about and other important information on my website, congressmanjimlangevin.com. Thank you all. Be safe, be healthy. And just one final thought. If you have friends and neighbors with disabilities or seniors, please remember to check on them, phone call or social distancing if you can, see if they need help with getting groceries or something at the pharmacy. The important thing to check on your friends and neighbors right now if you keep them in mind. Thank you all very much. Please stay safe and stay healthy. We are all going to get through this time. I promise you we're going to do our best and to help to do whatever we can to make it as easy as possible. But we are all in together, and we're going to get through it together. Thank you all very much. Have a good evening.